Okay, great. Well, you will notice me looking frequently at the screen that may not be looking directly at the slides because there may be others coming in over this hour and a half and needing to admit them just to make sure we get everybody on board that signed up for the webinar. But we do want to welcome those of you who are on now. We're excited that we can present to you something we've been, quite frankly, working on, I would say for over 6 to 9 months. And a little bit of background of why we did this might be helpful. Grow Midwives is going to be approaching our 4th year this November. And one of our major activities that we do, and I will say an asset, I believe, to the profession as we continue to build a database, is reviewing contracts and helping midwives negotiate contracts, as well as helping midwives interested in starting their own business or starting a birth center. And as Leslie and I and Joe had more and more conversations over those 3 years, we began to realize that we could refer people to nonprofit free services, which you may already have accessed, called SCORE or the Small Business Association, to help you sort of think about a business plan and how you begin to think about creating a budget for your business. But when it comes down to what's required for securing a loan or talking to a potential investor, it's pretty universal. They're going to expect something called a Proforma, which will include a budget and other financial documents that you're going to learn more about tonight and see how it fits in the midwifery world. We did a pretty extensive search about Proformas, templates that you can buy online, looking at family medicine templates, dermatology templates, dental templates that were all unique to those specific professions. But what we found, as you do in a lot of research when you're looking for resources, is gaps in information. And to our knowledge, there is no other Proforma designed specifically for midwives interested in starting their own business. So we took it upon us to try to fill that gap. And as a team of 3, with Joe's leadership, found additional accounting expertise to create this tool that we're going to share with you tonight. So there's 3 parts that we're going to be talking about tonight. The first part I'm going to talk about is really assessing your readiness to start a business and what are the key components to help you move from dream and passion to reality. Leslie's going to spend a little bit of time about going into that next phase. Once you're determined and you're on that path to building the analytics to enter into the Proforma, what is the necessary data that you have to collect to populate the tool? And why is it important that it's the best number you can come up with? And then Joe's going to spend a little bit of time talking about the output of the Proforma, the various financial, for lack of a better word, schematics or documents that most banks or small business loan officers will require to understand the probability of success and the risk they're inheriting by giving you money. We're also going to have time for discussion, and I think our guest is here. One of the midwives who we helped over the last few months with her partners to focus on the financial aspects of starting their own midwife business. So I'm glad they're able to be with us tonight to talk with you as well. So this is the first sort of phase where you're thinking about readiness to start a practice. It's very different to go from an employee to being the employer, from a staff midwife to the owner or director with financial responsibility. And it requires skills that we don't always gain in midwifery education. Shay, one of the participants tonight, came on earlier and we were talking about how the business aspects of ownership, let alone um, preparing you for the sort of the requirements to own your business is really not a part of midwifery education. As a faculty member for over 16 years, I can tell you in the two programs I taught in, we marginally covered issues around business, but we certainly didn't have time to dive into the details of how to own and start your own business. So this is a tool that can be helpful in a variety of categories of self-assessment. There isn't a numeric scale here, but it will give you some idea about where you may need additional assistance. And the first one is in planning. You may have a real good eye for the balcony view, for operational needs, for milestones, and how are you going to get from point A, which is idea, to point B, which is opening your doors. These are a variety of skills that you're going to have a variety of strengths and challenges in. And each of these may require you to have unique support from your colleagues, from your family, or from people you end up hiring. The next self-assessment concept is organizing. Are you good at project management? Being able to take all the details that's required and make sure they're either assigned to other people who are completing them, or you're completing them in a way that keeps you on that timeline you've established. So who's helping you in this process of the organizational structure you have? Are they trusted people? And is there accountability related to those elements that you're assigning out? Which brings us to people management. Leslie's going to talk a little bit more about this, but who is a partner in this experience with you? Are you hiring people early in specific roles? Are you delaying some of the hiring? How do you know what good HR principles are in who you hire and labor laws around employment? This may be an area that you may seek additional assistance on in terms of human resource management, as well as fair salary, employment contracts, and a variety of other components. The budgeting and financial analysis section really go hand in hand. The Proforma we're talking about tonight will give you a budget of what the costs will be for you to open and an analysis of costs, revenue, and profit over the next 4 years. So understanding revenue budgets and how to interpret financial data is going to be important to you as an owner, but also important in terms of predictability and good metrics to make this Proforma as reliable as possible when you tell your story about opening your business. And the last component is evaluation and problem solving. Sort of, again, going back to the balcony view and looking at all these different areas of your business design and development, and where you may need to collect more data to make decisions. There may be problems. It's unlikely you're going to go through this without any unexpected events that come up. And how is the decision making impacting this practice you're starting? If you're doing it alone or you're doing it with 3 or 4 other people, there will be problem solving moments that come up. And how ready are you, and what are your skills at being able to either participate or lead that kind of conversation? When we work with you in the first phone call, Leslie and I will spend time in that readiness assessment talking about what it takes to start a practice. We've created a checklist that will help guide the development of the Proforma. And what I want to do is just give you a sample of what's on this checklist that we'll spend time talking about. So this is not exhaustive, but it gives you sort of a window into what that first meeting is like. It's really important if you're starting your own practice, wherever that might be. Somebody might need to go on mute. Thank you. To understand the scope of practice in your state. I don't need to spend a lot of time on this, but we all know that that varies in terms of autonomy, independence, and whether there are requirements that could encumber your ability to independently and autonomously practice? Do they require a collaborative practice agreement with a signature? Are there prescribing limitations based on your licensure? Are there state laws that dictate who can be a partner with you? Do you all have to have similar degrees in education? Or, as we've learned, in some situations, there are midwives who become partners with physicians, which is not a universal model in all states. Is there an expectation for physicians you collaborate with to pay them? Our point is you shouldn't have to do that. And to be able to discuss why you shouldn't and have that physician relationship be supportive is one we really like to talk about a lot. It's one thing to want to start a practice, to decide, let's hypothetically say, you're going to only deliver babies in the hospital with an ambulatory clinic. It's another thing to have hospital privileges that allow you to do that. So, thinking ahead, are there potential barriers either to admission and discharge privileges or requirements about collaboration while you're in the hospital? Are there limiting privileges that the hospital has made in the credentialing process? What do you know about the hospital that you want to work with? Are there available options for location of services? Have you scoped out the geographic region that you believe is your catchment area? And will you be competing with any other services that could draw away from your particular uh, idea? And the last, which really is an issue, very public issue in the state of New York, is the debate over the certificate of need to create a birth center. And whether laws could impinge upon a timeline of when you want to open something that does require a certificate of need. We also want you to assess community interests and if there are competing services in the same catchment area. It's one thing to open a birth center in a highly populated urban or semi-urban area. It's another thing to understand what the risk might be to open a very large birth center with 4 birth rooms in a rural area. You need to think about the metrics of the possible pool of people you have that would choose to come to you. And are those numbers reasonable to support the cost of a freestanding birth center? In addition to the number of providers for the facility, as well as the number of providers in the community, not just obstetric and family medicine providers, but all types of midwives that could be options that compete against what you're wanting to design. So, what are the choices in the community? How much have you analyzed and assessed that? And will they impinge upon your potential pool? And the last is the reimbursement for payers. Maybe there have been midwives preceding you who have negotiated with commercial payers or state Medicaid. Are you aware and have you assessed what those likely reimbursement measures are? And how much influence might you have in establishing reimbursement for the model that you're creating? The last area, and again, this is just a snapshot of the assessment we feel like you need to think about before moving ahead with the Proforma, is what type of business model have you envisioned? Have you hired an attorney to talk about this in terms of a variety of business entities in the profit side or on the nonprofit side, or do you want to do both? It's very clear to us that starting a nonprofit business could take you months, and that may not meet the timeline of when you want to open versus creating a business that may take no more than 48 hours. And perhaps along that, as time goes by, to add a nonprofit arm to your business. So, securing a tax identification number, consulting a tax attorney, and, or we would say, and an accountant. Have you thought about learning through SBA or SCORE, which is present in almost every local community? These are typically retired business people who become your mentor, and it's free and no cost. When we started Grow Midwives, I went through my own SCORE mentoring for 3 or 4 sessions, and it was pretty amazing what I learned from the individual. And have you considered other venture partnerships with another midwife or more, with a physician, partnering with an FQHC or a community health center? Have you thought about partnering possibly with a university or a large physician group? There's a variety of models that may lend towards your exploring before you make that decision. So I'm going to turn it over to Leslie now. And Leslie, let me know when you want to move ahead.
Hi, welcome everybody. I want to start off by saying I have a respiratory virus that my grandbabies gave me. So I've got a cough drop in because it's either stuck on the cough drop or cough in your mic. So I apologize if I have to stop and get some water. I'll try not to get too coughing on you.
Can you move your mic a little closer?
Yeah.
It's hard to hear you.
How's that? Is that better?
It's better glamour shot too.
Thanks. Joe's always good for a compliment. Okay. Yeah, you can go ahead and advance, Ginger. Thank you. Shut some of these windows I had open. So I'm going to talk to you about the data part. And so just like anything else, the good data in, you get good data out. So if you're not putting in good numbers, this tool is not going to be very helpful for you. So how did we come up with some of these numbers? So what we did was look at my experience of owning a practice, a birth center. So our birth center practice is a birth center, but then we also do women's health. So what I could do is go back over the years and look at ordering of supplies and figure out, we do this many women's health visits, we do this many prenatal care visits, that we catch this many babies at the birth center, and divide that up so that we basically knew how many Q-tips we use per baby, so that we could come up with specific numbers for you to be able to use in this tool, that you're not just having to take a wild guess, because you don't know, you've never done this before. So how do you know how much you're gonna need? It's a little easier per birth because you're a midwife, so you know what supplies you need for that birth. But to think bigger, as far as prenatal, women's health, and lactation, and all the extra stuff you're going to need, it's hard to think of all those little pieces. So that's what we've done for you. So other things besides supplies, which is little stuff like Q-tips and chucks, and your medical supplies that are the replaceable stuff that you're going to go through. Then you're going to have your bigger dollar items. So exam tables, are you going to even use exam tables? When I first opened, I had one exam table, and then used chase lounges, since the majority of our visits are belly checks. You don't necessarily need to. We also know that people can do speculum exams on beds and not on exam tables. So those are just some of the personal things that you're going to have to decide for yourself. But we have the prices for what an exam table costs. Computers, you're going to need computers for charting. You're going to need computers for running the business. And so you're going to need a combination. So you're going to need your computers that are more like your desktops, which is your front office. And then you're going to need portable. So are you going to use iPads? Are you going to use laptops? The provider can take from exam room to exam room or birth room to birth room to do their charting in. And then also medications. Medications can be a little bit tricky, and that comes where you have to learn some of your state regulations, because the vendors who sell the medications go by the definitions of what advanced practice registered nurses are allowed to do in your state. So if it says collaborative or supervisory, regardless of whether that's actually true in reality or not, you probably will not be able to purchase medications. You'll have to have a physician who purchases them for you or under you, that you have their DEA numbers and things done. So those are some things that you may not even think of. It's like, you should be able to buy ampicillin on your own, but you may not be able to. And that's a state by state. Are you going to do ultrasound? I have my own opinion on whether you should or shouldn't. I'll tell you right now, the short answer to that is you should, because it is a moneymaker, even though it's a fairly pricey thing to start off with. But some of the newer laptop ultrasound machines have come way down in price from when I first opened looking at these 15 years ago. They were in the 50,000 and up range, and now you can get a really decent one for around 10K, which would pay for itself in the first year. Dopplers, how many Dopplers are you going to need? Are you going to do a Doppler per midwife or a Doppler per room? Then various equipment. You're going to need your reception area equipment, and then you're going to need things for like the guests in the exam rooms. And then there's lots of other equipment that you know, are you going to shred your own paper, or are you going to have a shredding company do that? Things that you probably as a midwife don't really think about a lot. It's like, what happens to those router sheets when you turn them in? You can't just throw those in the trash. So we've done that for you. We've looked at office supplies, you know, how many paper clips you're going to need, and pencils and pens and different things like that, so that we can give you the numbers and the prices, and then you tell us from the survey sheet the kind of style that you're going to be and what you think you're going to want. Ginger, you can go to the next. And some of this stuff, I opened my birth center initially in 2008. So that's when I did it all. You know, I never owned a business. My husband had owned a business, starting from scratch. But then we recently moved a year ago. So I kind of got to do it all over again with a little bit of experience. So a lot of these numbers are fresh. They're not from 2008 when I opened. They're last year when we moved. So when you get your survey, you're going to have just to answer questions. And so, like I said, good data in, good data out. So this is where you need to kind of do some of your homework, and you basically just go through and answer these questions on this survey. And then when you send it back to Ginger and I, we will put it in the Excel spreadsheet for you. And then that's what you get back. And I cannot tell you, when Ginger said, you know, we should come up with one of these tools, I go, this is going to be so invaluable, because you really cannot open a business without a really good Proforma. And what makes midwives great midwives generally doesn't make them great at doing Excel spreadsheets. I myself am Excel, I have like Excel anxiety, just even looking at it. Joe, thankfully, is a wizard with it. So he's been able to, you know, help us go through it along. And so I know that most of them, when they even look at how to do a Proforma, when you are first given the assignment that you're going to need this, which can be very intimidating. And I think it can actually probably stop some midwives in their tracks from even wanting to go down that path. They're like, I can't even do this. I don't even know where to start. So this way, it's easy for you. You're just going to answer these questions. So we've gone over this over the last few months. We also had, you know, like Ginger said, we had a group of midwives that were starting a practice themselves. So they were kind of like our beta testers, and we added to it. And I think we've got most everything in there, so that you're going to get a great product at the end that you will. And what you do with this is you take it to bankers and investors. They want to see this. They want to see, what is it going to cost to get your business started, and then when are you to start making a profit. Patient types and services. So how many office days are you going to have in a week? Are you going to be Monday through Friday, or Monday through Thursday? And that has to do with how many midwives are you going to have. If you're doing this by yourself, you're going to need one day that's your admin day. So you're not going to see patients that day, because that's the day that you're going to do your administrative work if you're the owner and director of the birth center. How many patient types? Yeah, how many OB patients? How many GYN visits? Family planning, well woman, NSTs, ultrasounds, all these things. Anything that you think is going to generate income, we want to know. So some practices know they're going to start off doing lactation services. Then that would be the other, where you would add that in there. And you want to make sure that you account for, you're going to have patients that are not coming from you from the first visit. The majority of patients that come from birth centers transfer after their initial visit with an OB somewhere else. Women, when they first get pregnant, they just want to see somebody as soon as they can. And then they start thinking about what kind of birth they want and start looking around. So it's most birth centers, 50% or more of their patients transfer after the first trimester. So you're not going to, when you're figuring the patient types, you're going to not think you're going to have 12 prenatal visits for every baby that you're going to deliver. The number of providers seeing patients. So how many are you going to have when you start? I started by myself, but most usually start with 2 or 1.5, one full-time and one part-time. And then how many midwives are you going to have in 6 months, in 9 months, in a year, 2 years, 3 years? And those expenses are also put in this. So that's their salaries, their benefits, and those expenses. Okay, Ginger. Thank you. Revenue generation. So this can be a little bit harder to get this information. If you're starting a birth center, we usually recommend that you take the How to Start a Birth Center workshop first, and they can help you with some of this information. But what you can find out for sure, as far as your price, who's going to pay you what. Medicaid is public, so you'll be able to find out from Medicaid how much they're going to pay for you as a professional fee to deliver the baby, and then there's the facility fee of using the birth center. And then from there, you can add a percent to figure out what Blue Cross Blue Shield and the private payers are going to pay. And then you have self-pay. Self-pay people generally also expect a discount. So you have this number, whatever you come up with, this is what you're going to bill, but you're never going to get paid that because you contract with the insurance companies. So if you give them a discount, you can give your self-pay people a discount. So you have your realistic number and then the number that you're actually billing out. And you want to figure out what's that mix. And so some of that you can get from your demographic information, as far as if you're going to be in an area that is low income and you're catering toward low income women, then you're going to have a very high Medicaid rate. If you're in a more affluent area, you're going to have a much higher private insurance. Rural, you tend to have a lot of self-pay patients. So your demographics will help you a little bit with that. And then you want to project how many babies do you think you're going to be doing year 1, year 2, year 3, year 4. And the number of births per month is very closely related to the number of providers that you have. So those two things kind of go together. One person can only deliver so many babies in a given month. And also if you don't have appointments available, people are going to go somewhere else. So if it takes 6 weeks to get in to see you because you're booked out, you need to have another midwife coming in so that you're catching those people before they move on to somewhere else. So you do have that average global fee, which I talked about earlier. And you're going to have that as the professional fee, and then a facility fee if you're having a birth center. If your business model is that you are a clinic and you're going to do the births in the hospital gets the facility fee. You also want to know what the rate is for an annual exam, and that is going to be the same as Medicaid. Those Medicaid numbers are available, and then you can take that number and estimate what the private insurance are going to pay. Same thing for well woman care. Annual exams are pretty much a given set number. Then when you bill for problem visits, it has to do with time, how much time that you spend with the patient. And then there's lots of other billable services that you can add to. We talked about lactation. There are people who have little niche practices that are included in there. They may do some fertility work, or they might have pelvic floor physical therapy, or urogynecology, or whatever it is that their little extra niche is. So you want to include that in there as well. Anything that could be an revenue producer. Are you going to first assist on your births? So that's something you want to talk to with their hospital as well as the physicians that you're working with. And if you can at all negotiate that you get to first assist. It is a revenue generator, and it's a pretty decent revenue generator. But also what it does is allow for more seamless care for the patient. By having the midwife who's been with them through the whole time. And when you explain that to your physician, they're a little nervous doing a C-section on a patient that they've maybe met once or not at all. And you say, well, if I'm there as the first assist, then I bridge that gap. So it's not that the liability issue is lowered because you've got that trusted person there with you doing it. Then classes. What kind of classes are you going to offer? Are you going to do yoga? Are you going to do prenatal education classes? And are those going to be taught by the birth center or the practice and build through that? Or are you going to allow a local instructor to come into your practice and she's going to pay you to do it? You could do it either way. And then any other kind of income that you can possibly think that you might have. Our birth center is set up so that I leased some space to other providers. They pay me a dollar amount per month, and they use 2 exam rooms and 1 like consult office room. And that includes a chiropractor, a pelvic floor physical therapist, an acupuncturist, and a psych mental health person, and they share that space. So they're one group, they're one company that gives me 1 check a month, but that's more income. And that is not an uncommon thing specifically for birth centers to have other professionals that sublease some space. All of these people have other offices in other areas. They're just here at our birth center 1 or 2 days a week to be able to allow us to be more of a one-stop shop, a community, and offer many services, but also be able to build their practices without having the investment of having an entire building and a whole another business. When you go to look at how you're going to charge these people, you got to remember it's not just the space they use, they're also using your waiting room and your bathrooms and your hallways. So you know what you pay per square foot for your mortgage or your rent, but you're going to charge them more than that because they're using more than just that exam room. Next slide, Ginger. And I'm done. Thank you all very much. Got through it without coughing. And I'm going to go back on mute. And Joe, I'll let you take it over.
Before you start, Joe, I just want to say that we're giving you sort of little snapshots, right? That's not all of the data that you would be doing in the practice survey, but certainly gives you an idea of the depth and breadth of information that will be required. Thanks, Leslie. Joe?
Yeah, I think it's important at this point to kind of pause and think through really what we're up to at this juncture is after you've had these kinds of conversations and accumulated some of your own information that you can count on, and then relied on other people, including Leslie and Ginger, you try to hammer this into a calculation so you have an idea of what's going to happen as you move forward. And the more honest that process is, the more confidence you have in it. So the first function of these forms, and if you want to advance the slide, Ginger, is to give yourself a realistic view. I mean, all through this process, you're going to be looking to see if you or your partners still are hanging in there to want to begin this enterprise. Because anytime you begin your own business enterprise, you're not only inviting the risk of what you invest, but other risks as well. Your personal effort, your personal assets that you've guaranteed, et cetera. And so it's quite a serious enterprise if you go through it. But the idea is to try to balance things like the startup funds required and develop those capital assets that you would have as you move forward, such as there was talk about having ultrasonic machines and a few of those things. And what we're trying to do is to help people get to the point that they can understand some of the finances. We're not working integrated with people like the tax accountants. Some of these investments that you have could have the blessed response that you would owe absolutely no tax the first year or two, because you could depreciate out completely some of these tech, for example, some of these tech investments within the first year, so that you don't have a tax liability, those sorts of things. But you begin to consider and think about all these different costs. I see payroll costs on our list, and one of the things that comes to mind is I one time started practicing with a couple of attorneys, and they treated me as an employee, and suddenly discovered that the extra tax costs, Social Security, the FICA, it could be a few things like that, they'd never really thought about as having me as an employee. So, generally lawyers think they've got a promotion if they become a partner in the enterprise. In that instance, the people I was working with discovered I was making as much or more than they were, and that they were carrying some of the financial burden for that. So I got demoted to partner because they realized that some of those costs were spared. So it's the point being that you need to really understand the true costs of having employees on board, of having these various things, and to look out over a period of time. I don't think anybody's going to take an initial pro forma from a startup small business that doesn't demonstrate how much money you're going to lose the first year or two. That you start off with some kind of investment and you have a grind. It's okay for the key people that start the enterprise to draw a salary even from borrowed money. But at the same time, they have to be able to recognize that they're taking on this this responsibility, and that it can't be measured by days or weeks. It's measured by years. And the longer you go out, the less accurate you are. So what we're starting to look at would be those documents that other people need to see that you may not necessarily understand. So what we did in creating our tool is to come up with at least some level of a set of documents that wouldn't require high-level accounting or high-level business consulting work. We bill out this project and what might for far less than what might cost $8,000 or $10,000 if you had people putting very sharp pencils to the same data. But you get an idea of amortization and depreciation. You get an idea of the operating expenses in the first 5 years and what kind of cash flow you're going to have, and income statements, the balance sheets, those sorts of documents that may not make any sense to you as how they're constructed, but it gives you a very professional appearance as you begin to work with it. You want to move on with the slide, Ginger. Graphical interpretations are helpful both in the sales process, but also in looking at what you have. I would look at this particular graph of a birth center and some projections that we have. You'll notice that revenue, gross margin, net earnings is in the negative. That's the gray box there in 2021 as things move forward. And you have this trend line that just swoops blessedly up into the future as though all earnings are, going going to be massive. When you have this kind of growth, it really gives you an idea that you have an increase and a stability. It doesn't take into account the kind of things that happen if you start making that much money and start making different decisions. For example, there's nothing in this curve that would have each of the two key members, let's say, that start the midwifery practice, each buying a nice car, because their tax advisor is explaining that if you have that as a legitimate deduction, you're going to have less taxable income, but of course you have more expenses. But this gives you some kind of tool to see what happens if you prime that pump and you keep working on it. You're going to first get a few gasps of dry air. You're going to get a few squirts of water, and then later you get the whole thing. And this gives you an idea of what it looks like. You want to go on, Ginger? And so some of these charts that we see here that make many of us go cross-eyed are the kinds of costs of sales is an element that not only flows through your calculations from things like how much do Q-tips cost, all the way through to, in this instance, we have 2 midwives, then 4.5 midwives, and 7 midwives over a period of time. It begins to give a realistic thumbnail sketch of what it costs to run an organization. And if you look at any business or any business tax return, or any 1040 really, if you're self-employed, you have total income and then total cost of sale, net income, and then you go on down to whatever your taxable liabilities are. This is a fundamental accounting kind of question. What is your cost of sales? And if so, then what is your revenue generation later? You want to go to the next one? And so what you get is sort of an idea real quickly. And in this case, we have the waterfall concept of total revenue for year one. And in this case, year one would be less than a whole year, but a total of $368,000 that you've hoping to actually bring in. Costs of goods sales, gross margin, all those things are calculated out. So you get an idea of how you're going to function by year one. As both Ginger and Leslie pointed out, this is all really a matter of how realistic you're being in managing these expectations and trying to figure out what those costs are. So as we begin to work with people, it's a series of steps. And you may begin with the idea of we're going to rent someplace. We think it's going to be about this big, to we now have a landlord who is going to provide us space. And then how is it going to look to work that space up? I often joke the wall behind me is I did just exactly for COVID when it came along, but I did about 2 years earlier. We refitted in a really ugly area in a bank building. And one of the things I wanted was to have something that reflected my style of being a woodworker. And so I put this wall up, those kind of costs. And you saw part of Leslie's beautiful environment for her practice in an earlier slide with the tub and all that. You got to figure out how to fund that physical plant. And I've been fortunate as I've moved through, at least I still calculate it as fortunate, in that I've always put all these physical improvements to the leasehold inside the lease. And so I haven't walked into an empty shell of a lease space and then had to hire contractors and get permits and create stuff. Other people have done it the other way. And then I know from doing family law and looking at how people develop wealth, some people have developed tremendous wealth by having some kind of professional practice operating inside a building they bought. And what they became most wealthy for was the development of the real estate, not necessarily their professional work. So you got to think through all those elements and what they cost, and how they're going to amortize over time, and how much you're going to borrow. Want to go to the next one? So you wind up with this kind of balance sheet look, and you'll notice on this balance sheet, net earnings starts off as a loss, and then begins to escalate in a fairly remarkable way. We may not be able to read those balance sheets as well as other people who can scrutinize them to begin to see. So it's a matter of working through the details to try to make sure that you have a realistic projection. It may not be a realistic projection that you're going to wind up with 7 midwives and a couple of other employees here and have $1 million worth of income in 2025. But what you do have is a realistic expectation that if you invest the original money coming in and have a good size several midwife practice as we have here, that you have a realistic expectation of bringing money forward. And most importantly, as you look to the bottom of the balance sheet on total assets, you begin to see you're beginning to create value. One of the things that anybody that's building a business like this has to take into consideration is the kind of heritage planning you want to do. One of the best reasons to build a wonderful, robust midwifery practice is to leave the darn thing in the dust and to be able to sell it or be a participant in it in some way, but go on and use it as your retirement vessel. I do family law. That means divorces and that kind of thing. And the idea that the kind of value you can have is vested in your business is pretty profound. When I do small business cases, I will usually find that those people don't have the robust 401k or pension retirement plans. Their pension is in their business. And so part of what you're trying to say here as you build up equity in the business or total assets is that you're building a marketable product. So when you're looking at building a midwifery professional practice, you're looking at building something that allows you to exhibit your professional skills in the most profound way. It allows you to expand those skills out into a better market, but then it allows you to then sell that end product for something of value. And this is the sort of practice that is transferable and becomes a tremendous asset. And so you're trying to look to build that. And of course, if you're looking at trying to find investors that are looking at the same kinds of concepts, are they looking for a way in which there's every reasonable factor that you would begin to develop wealth? Next slide. Ginger, I'll defer back to you on the process.
Okay, thanks. So we've given you sort of an overview of what happens if you decide to work with us on developing a Proforma for your business. You would first meet with Leslie and I for an hour or longer if we need to talk about your readiness, your resources, how far along are you in understanding key data points that are unique to the type of business you want to start. And if you want to move forward after that hour meeting, we'll ask you to complete the practice survey tool, which we've introduced to you tonight. It's not something you're going to get done overnight. It may take you 2 or 3 weeks. It may take you longer based on other things that you have going on in your life or a full-time job you may be engaged in. It may take you 2 or 3 months, but that practice survey tool will no doubt require Leslie and I to clarify some points that you've entered, to have conversations back and forth to make sure that we're entering correct data and that we're interpreting elements of how you filled out that tool. Once we have entered all the data, which right now we're anticipating will take us a couple weeks, and our wizard Excel guru Joe has verified with us that it's meaningful data. We'll set up an hour-and-a-half meeting with you to talk about what your Proforma means. And again, go through another round of questions and discussion, any possible modifications. Have you changed around the equity you're going to invest or the number of staff you're going to have in year 1 and 2? So again, trying to continually refine as you make more firm decisions. And at the end of that meeting, we'll produce for you a readable document that will include, I think I should know this, I don't have it memorized, 7 or 8 different documents that will be a part of the Proforma that you receive. We're more than willing to continue with additional services and ongoing support if you need that, or preparing a business plan that will go along with the Proforma to the loan entity. And those are things we can discuss as you may or may not need them. So I'm gonna, before we open it up to Q&A, Shana, I believe you're with us. If you are, I would love for you to turn your video on and share a little bit about your experiences in making decisions and also in working with us.
Hi guys. So I'm Shana French, and I have had the pleasure of working with Leslie and Ginger and Joe on our business, which is Envision Midwifery and Healthcare. It's been a long journey for us. It's myself and 2 other partners. We did start off with 5 people, and now we're down to 3. Just to give you one example of how the journey brings a lot of different unexpected changes, and how you really have to kind of roll with the punches. And so we started working on this idea almost a year ago. And through the last year, we've gotten to the point where we are submitting our loan application literally today for the Small Business Association loan. And we're hoping to know within a month if we've been approved and will receive funding in our bank. So that's been exciting. Yay. So what we are doing is the 3 of us are all CNMs, and we are attempting to open the first private practice midwifery group that will be owned and operated by midwives and will have privileges at a hospital. There are plenty of home birth practices that are owned by midwives, but no practices that have privileges at a hospital owned by midwives. So, new things.
Shana, Katie has come on. One of the things
Great.
that might be helpful to some of the listeners is your experience moving through the Proforma process and how you prepared, but also what you learned.
Absolutely. So one of the biggest things is that the financial aspect is so intimidating because, as they said earlier, we don't have any training in this. So Ginger, Leslie, and Joe have made it really easy through the questionnaire that they gave us to make us think about all the different aspects that we needed to have nailed down in order to provide accurate information for the Proforma. And just when you think you've decided on everything, the questions that they ask spur you on to make decisions that might be hard and challenging, and to think about things you might not have considered previously. And their expertise has really been so crucial in knowing how to account for a lot of different financial decisions and outcomes. And so it's been, they've made it easy to understand by using the financial proforma. What I don't think we understood was how much change would happen from the first version of our proforma to the end, based upon how rapidly things change in our business world. So,
And one of the things that I recall that were changes was very seriously input from you guys. It isn't one of these go to the mountain and find out what the answer is. It's a partnership. And one of the things I've most appreciated in working with you guys is how brilliant you are. And it's been nice to see, and to be in partnership with somebody. We're not trying to be the ultimate business consultants to somehow create wealth. We're trying to be partners in that process. And all you guys that have been sticking with us in this beta version, it's been wonderful to be challenged by questions like that.
Yeah, Katie, I think you joined a moment ago. You've heard Shayna share just a little bit. Are there things that you would like to comment on related to your experience in creating your own startup?
Yeah, sorry, I was finishing up bedtime with my kids,
That's
but
okay.
yeah, I think the partnership thing just highlights exactly what the experience was. I think we entered the Proforma even after we answered the questions with a lot of assumptions about what we would do. And I think through your guys' expertise, it really got us to think about other ways and what ifs, and really had us look at it, I think, from a more of a business lens instead of this idealistic vision that we had created, and helped us build a stronger business plan and has strengthened our business overall.
Thanks, Katie. When you would give advice to others about the realistic timeline from sort of concept and idea to today when you submitted your loan, any thoughts about that?
Say add at least double the time that you would think. At least, and if you could triple it, that would probably make your life a lot less stressful.
Yeah. It
Yeah,
is a longer process.
Everything takes a lot longer than expected, especially if you guys are going to be continuing to work full time and having families. That really makes it challenging.
Well, I'm thrilled you're both on, and I think what we'll do is keep moving along. And as questions come up, Katie and Shayna, you're part of our team. Feel free to help answer some of these questions. I do want to point out, and all of this can have a little bit to do with starting your own business. These are very, very popular webinars that we've been tracking.
I wonder if Heather had a question.
I'm gonna open it up in 1 second, Joe. If you want more information on the employment side of hiring people, this could be of value based on the work environment you're in. And there we are.